Mrs. Fletcher. This patient is very well known to me. She's usually really healthy. It's not often we have a 70-year-old woman with only a history of well-controlled hypertension. She only takes, lisinopril, baby aspirin, a multivitamin, and, oh yes, she's on tamoxifen for that breast cancer she suffered a few years back. Surgery, chemo, radiation. She's good as new. It looks like she's in here for fatigue. That can be difficult to figure out. This will be a good one for the students. Her vital signs are normal. Let's go see her. Hi Shirley, how are you?
Hi doctor, I'm doing well. How are you?
Very good, thanks. Actually, if you don't mind, I have a few nurse practitioner students that would like to be observed.
Hi ladies, that's fine.
Great. Can you tell me what brings you in today?
I've been feeling very tired and recently I was short of breath.
Are you getting short of breath now?
I'm not, I'm just feeling quite tired at the moment. A few days ago though, I was gardening and was extremely short of breath. Very frightening.
Really? So you've been working in your garden a lot lately?
Not particularly, but I had wanted to get a few things done that day.
Gotcha. Okay, has anything else been going on physically with you? Any chest pain, jaw pains?
Nope.
Nausea, vomiting, anything like that?
Mm-mm.
How about swelling in your feet and legs? Runny
Nope.
nose? Cough?
I'm fine.
How about any troubles urinating?
Nope, none.
Okay. Any other new aches or any pains that I should know about?
Nope, I seem to be completely normal.
All right. How about any changes in your appetite?
Nope, same as always.
Sleeping well?
Yes.
Okay. Let's let me do a quick little physical here. if I could. All right. Okay. Let's take a look inside of your eyes here for a minute. Okay. Okay. All right, let's have a listen. Take a deep breath. Well, your lungs are clear and you don't have any swelling. Do you think you can give me a urine specimen?
That's fine, sure.
Okay, we're going to run with that and then I think we'll do an EKG and I'll be back.
Okay.
Okay, Mrs. Fletcher, I think you have a urinary tract infection.
Oh, really? I haven't had one of those in 20 to 30 years.
Well, sometimes people can have a UTI and not even know it. I think that's what's making you feel so tired. Your body's trying to fight that. I'm going to order you an antibiotic. I want you to come back in about a month or so, just to make sure everything's back to normal. Give us a call if you don't feel better, or come back if you have any other troubles with your breathing.
Okay, thank you. Thanks, girls.
On that UA, I would have probably sent it for a CNS. He's just randomly picking an antibiotic. We want to make sure we're treating the right bug.
You know, I noticed that the doctor didn't examine her very well. I know she's a well-known patient to this doctor. She's been here for many years, and she was just here 6 months ago for a physical, but I think I would have done more of an exam. Like, I would have checked her conjunctiva to see if they were pale, especially with her fatigue, her lymph nodes, her thyroid, cap refill, JVD, and I'm really not sure that we should be treating this UTI. I'm thinking something else may be going on, so I would send her for some different labs. Maybe a CBC with differential, a CMP, a TSH, LFTs, B12, and folate to see what's really going on.
What would I have been done differently? I don't know. He's a doctor.
If I had to give some differentials for Mrs. Fletcher today, I think I would include anemia, depression, thyroid problems, infection, malignancy, deconditioning, and even allergies. I'm really thinking that respiratory isn't a problem since we listened to her. Her lungs were clear. She doesn't have any asthma. She hasn't had any cardiac issues. We listened to her heart, no extra heart sounds or edema. So I'm going to go with these differentials.
Well, I guess that the obvious differentials would be a UTI, thyroid problems, anemia, or depression. It could possibly be a side effect of medications she's on, like, for instance, tamoxifen, but I looked it up, and fatigue is a symptom, but she's been on it for 2 years, so I think she tolerates it fine. It's not that.
Mrs. Fletcher, hello. How are you doing?
Oh, not so hard to breathe, not well.
Okay, let me check for some swelling. Oh, yes, we have some swelling here. Okay, let me just take a quick listen. Your lungs are full of fluid. Okay, we're going to need some oxygen in here. Sandy, get the AED. Claire, call 911. Let's get you comfortable, Mrs. Fletcher. Mrs. Fletcher, your heart's not working very well. We're going to get you to the hospital right now.
You know, even after having that happen, that scary event with Mrs. Fletcher, we still have to come up with some differentials. Right now, I'm thinking she could be having pneumonia, it could be CHF, she could even be having a heart attack or a pulmonary embolism. I hope we find out soon.
Wow, that was a close one. This is not just a UTI. It could be an MI, it could be pneumonia, it could be a pulmonary embolism, or even CHF. I hope she's okay.
I don't know what is happening. Is she dying?
Mrs. Fletcher, hello.
Hi.
How are you? How are you feeling?
Well, I'm feeling much better than I have been.
Well, I wanted to check back and see how you're doing. I brought my nurse practitioner students to check on you as well.
Oh, that's so kind of you to come
You're
see
certainly
me.
looking a lot better than the last time I saw you.
Thank you.
I'll be looking forward to seeing you in about a month in my office.
Okay.
Very good.
Her diagnosis is that of cardiomyopathy. It is the result of receiving chemotherapy and radiation treatments due to her breast cancer. Both of those can be cardiotoxic.
This one I know. BPH.
The BNP is the best indicator of CHF. It is a peptide that is synthesized and secreted almost exclusively by ventricular myocardial cells in response to elevations in end diastolic pressure and volume. It's the best thing that we have to show that a patient is in CHF.
The tests we would see in her chart would be obviously a chest x-ray, an echo, EKG. The labs would be a BNP, CMP, magnesium, a CBC, and a CKMB with troponin. And looking through her chart, I saw that the chest x-ray showed some cardiomegaly. The echo showed an ejection fraction less than 50%. CKMB came back and troponin negative, so she did rule out for an MI.
Fletcher, hello.
Hi.
So you've been out of the hospital for a couple of months now. How are you doing?
I'm doing so much better. I feel wonderful, actually.
Great. Let's just give you a quick little check through.
Okay.
That sounds good. Doesn't seem to be any swelling.
Great.
Let's have a listen real quick. Well, your numbers look really good. Are you having any troubles with your new medicines?
I am not.
All right. Do you have any questions?
I don't. Thank you, doctor.
Great.
And thank you too, ladies. You're going to make great nurse practitioners.
We'd have her on an ACE, a beta blocker, an anticoagulant, and an aldosterone antagonist, such as spirulactone.
Her medications that we would see would include an ACE inhibitor, beta blocker, an anticoagulant, and an aldosterone antagonist.
everybody else say? I usually agree with Sandy. I would say whatever Sandy says. That's probably, I would agree with it.
We definitely want Mrs. Fletcher to stay active. We would like for her to ride a stationary bicycle or even walk. The restrictions will be is if she has any kind of weight gain or if she's not feeling well. She should not do any exercise. She needs to rest her heart.
NSAIDs. This I know. This one I knew. What symptoms? I know this. What are the symptoms of heart failure? Weight gain, shortness of breath, edema, bloating in the abdomen, difficulty lying flat or a need to sleep on more pillows than usual, cough, increased fatigue. Gotta get one of these.
Once a patient is discharged from the hospital with CHF, they will be seen regularly and frequently by their cardiologist. And we in primary care will be seeing them and managing other conditions and other medical problems that they have. And we will refer to the cardiologist at any time that we need to. I can tell you now, I have become very familiar with CHF, and I will be able to recognize and manage these patients. I know the medications they should be on, I know the symptoms that they are having, and I know when to get them to the hospital.
Well, I think this was a tricky case because I've been caring for Mrs. Fletcher for such a long time, and I knew she didn't have many of the risk factors for CHF. 1, no uncontrolled hypertension. 2, no history of MI. No history of heart valve disease. And lastly, no history or family history of cardiomyopathy. I'm just glad it turned out for the best.
I just want to say, I saw something. I know you asked me this a while ago. You know the doctor forgot? S3. S3.